Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And today I have a very special guest with me here. Today we have Dr. Petrea Cober, and we will be chatting about her upcoming presentation for the Gold Neonatal online conference here at Gold. Welcome, Dr. Petrea Cober.
Well, thank you so much.
It is wonderful to have you here with us today. And we will dive into your presentation in just a minute here. But to our listening audience, where in the world are you located?
So I currently live in Ohio. I practice in Akron, Ohio, so just south of Cleveland, Ohio, so in the Midwest of the United States.
Thank you for sharing that with us. What is the weather like today? Is it like spring-like? We have May now here.
Well, it was a bit warmer yesterday, but today it got a bit cooler, so it's very dramatic some days, but at least it's not raining.
Yeah, at least it's not raining. That's good to know. Okay, so tell us a little bit about yourself. We want to know a little bit about what is your professional background, and maybe you can share a little bit about your professional journey as well.
Yeah, so I'm a clinical pharmacist. So I went to pharmacy school at the University of Tennessee, and then I completed 2 years of residency in pediatric pharmacy. So the first year was a general pharmacy residency at Penn State, and the second year was a pediatric specific one at the University of Michigan. I then practiced for 5 years as a pediatric surgical pharmacist at the University of Michigan Children's Hospital, and really got involved with nutrition and nutrition support. So primarily was working in the neonatal intensive care unit, but also still did the pediatric intensive care unit and some intestinal failure patients out on the floor. After that time, I moved to Ohio and took a position with Akron Children's solely in the NICU. So I'm a neonatal pediatric pharmacist. And I also teach pharmacy students at Northeast Ohio Medical University. So I teach pediatric pharmacy primarily and nutrition support there.
So you're teaching and you're out in the field in the NICU as well. How wonderful. So tell us a little bit, how did you get involved in the field of nutrition specifically? How did that happen?
So the University of Tennessee, where I went to pharmacy school, has a very large contingency of nutrition support pharmacists, both in the pediatric and the adult population. So I was able to do a research project with one of them when I was a second year pharmacy student. And then as a fourth year pharmacy student, so that'd be right before graduation, I was actually able to take a rotation with them. Found out I really enjoyed the practice of nutrition support. So I asked to do nutrition support rotations in both years of my residency program. And then there really wasn't a pediatric nutrition support based person at the Children's Hospital at the University of Michigan. They had a more of an adult based person who was kind of managing both adults and pediatrics. So when I started with the pediatric surgeons, I became the nutrition support person or the contact person for the Children's Hospital. So became very involved through that activity. And then the Intestinal Failure Center at the University of Michigan at the time was just getting started, more multidisciplinary. So I worked with that group as well. And they got me involved in ASPEN, or the American Society for Parenteral and Enteral Nutrition. So really it was something that I loved, nutrition support, and just kept on getting opportunities to work in that field.
How wonderful. Thank you for sharing that. And I have a question. I'm not in the NICU, so, as I mentioned before, I'm a midwife, so excuse me for my ignorance here. But so you mentioned there was in her first hospital where you were positioned, there was more not so much a pediatric-based nutrition support expert, but more for adult. So is that not very usual to have a pediatric specialist in the NICU? Or is that hospital from hospital to hospital? Does it vary?
So it's very common to have a neonatal pharmacist. Whether they enjoy nutrition support is the difference. So that's the bigger question at hand. A lot of times they do it, but it may not be the biggest thing that they do in that unit. So there was already a neonatal pharmacist. Her goals were just not nutrition support based. So.
I understand. Well, thank you for clarifying that. And that leads me to my question is that nutrition is such an important important factor here. And we're talking, critically ill babies, premature babies, right? So it makes a lot of sense to have a specialist like you, stationed there in the NICU. And a question that came to mind for me is, and maybe that leads a little bit into your presentation as well. I do believe there is probably a lot of differences in nutritional requirements in depending on what's going on with the infant. Is it a, very premature baby, or, is it the baby more closer born to term? Tell us a little bit about that.
Yeah, there really are two kind of distinct categories in the neonatal intensive care unit. So there are all the really small babies. So they're very much behind. They missed out on a lot of good nutrition that their mom would have provided them when they were in utero. And so I'm having to provide them with nutrition um, first from more of an intravenous route until I can get the enteral nutrition on board and in place, which we're huge supporters of maternal milk at my institution. So until I can get all that maternal milk into the little one, I need to give the intravenous fluid or parenteral nutrition. Then there's the other side. We have really sick babies, usually more closer to term, who either have surgical issues or other conditions that just prevent them from tolerating full enteral nutrition. And so they need a little bit different needs than the very small patient. But they can get behind very quickly because no baby has really great stores of nutrition that they can live off of for an extended period of time. So oftentimes it's within several days, depending on, how old they are or something, that you have to start some parenteral nutrition. The littler ones we start almost immediately. So.
Well, thank you for sharing that information here as well. Now let's talk a little bit about your presentation. And your presentation is titled Challenges in the Neonatal Intensive Care Unit. Tell us a little bit about what you will be presenting on.
So there's a couple of challenges. So the first one is really just a nice background information of, what are your basic requirements for your different ages of neonate in the unit, because they're a little bit different depending on if you have someone who's born at 23 weeks gestational age versus someone who's born closer to term and may have other illnesses on board. So going over those basic things. Also talking about the different fat emulsions that are currently available. I know in the United States we had only the soybean-based emulsion for 30 plus years, and now we've gone from a one fat emulsion system to now we have 3 different fat emulsions, and what can we use for which patient and which one's really the best given all the different circumstances. The next thing we move into is some compounding challenges that present themselves, so more of a calcium phosphate situation. So our very small infants really got behind on how much calcium and phos they would have gotten from mom, and so they don't lay down good bone. So we want to give them as much calcium and phosphorus as we possibly can. Unfortunately, calcium and phosphorus, when you put them in the same solution together, depending on the concentration, they can actually precipitate out, and that would be very bad in that situation. So addressing some of those challenges that we have in the neonatal population. And then the last one is compatibility. This is the one that I find oftentimes in the neonatal unit, more so than any of the other units I've worked in, like pediatric intensive care, or when I was doing a little bit of adult medicine in my residency, my first residency, is compatibility issues, because a lot of times a neonate only has one venous access line and everything has to go through that access line. And a lot of times what we do is we're pushing the calcium and we're pushing the phosphorus, and we have newer medications, and we don't always have compatibility in that one lumen for the patient. And so really, how do you balance it, and how do you find information on when you can actually co-infuse different solutions together? I find that to be one of the biggest questions I get from nurses in the unit.
Absolutely. That was actually one of my questions. You kind of answered that we will learn about that in the presentation that I had next for you about the access line, because there is only one, and how is this going to work out and such. So, well, thank you so much for answering my questions here today and talking a little bit about the challenges here. Before I let you go, what are you hoping our delegates will take home with them from this presentation?
So what I'm really hoping for is just some, basic knowledge, and then how you can use that knowledge and resources that I'm going to start providing and pointing out that you can seek information from, so that when you have your own challenge at the bedside, you know where to go and what information to look at.
Fantastic. Thank you so much. Thank you so much for answering our questions here. I am looking very much forward to your presentation, and thank you for all the wonderful work you're doing out there.
Oh, thank you so much.
And to our listeners, this presentation titled Challenges in the Neonatal Intensive Care Unit by Dr. Petrea Cober will be live on June 10th, and this presentation is part of the Gold Neonatal Online Conference here at Gold. To find more about this presentation and about the other presentations in the conference, please visit goldneonatal.com. Thank you everyone for listening here with us today. Bye bye for now.